So, hi, Dr. Diaz. Welcome to our VL Spotlight. It's my pleasure to have you here today. How are you
The
doing
pleasure
today?
is all mine. I love you guys' company and what you've done to help me.
Amazing. Well, thank you very much, Dr. Diaz. Thank God it's Friday. The week is almost over. So to get started, just tell me a little bit about your week. How is it going so far?
So good, busy like usual. So that's why I think I need my VA most of the time. But so yeah, been pretty busy seeing a couple of patients, but also doing some yoga as well. So pretty good.
That's nice. Well, it's really nice that you do yoga. Well,
I try to get the time for that.
I can imagine. I can imagine you have a pretty tight schedule. So, well, it's very good that you actually find the time to practice yoga. So that's amazing. So, well, on my end, I could say that my week has been, let's say, a bit balanced so far. Not too many things to do, but enough to keep me busy. So, first, Dr. Diaz, I just wanted to ask if you could tell, well, all the people who are watching this video now, a little bit about what you do and what's your practice about.
Perfect. So I'm a psychiatrist and board certified psychiatrist. I train mostly in Puerto Rico, so I see a lot of like Spanish speaking patients, but I mainly just provide psychiatric services, right? I have a practice called Better Connections, and I have two other providers, which is beautiful. I have Sarah Miller, who's a nurse practitioner, and Luz Bogle, who's a physician assistant, and myself. And we just see patients as much as we can, basically.
Yeah, exactly.
And we are like 9 till 6 p.m. seeing patients most of the time. And we see everything from like, yeah, young adults. We have some adolescents, but like young adults all the way to geriatric patients.
Okay. Well, thank you very much for sharing those details. It's really good to know that we can find that the people can find professionals like you, helping with their mental health. So that's amazing. So, Dr. Diaz, I am aware as well that you started this practice in 2021, all by yourself, and I would just love to know how was your transition from being an attending, to opening your own practice.
Oh wow, what a good question. Okay. So and it's very beautiful because it has been a very good process. Ups and downs like usual, but a
Yeah.
very beautiful process. I think it just started more like I already had a patient load when I was an attending, and it was more of like, well, I want to do this, discussing it with those patients. They became almost family, and then they followed me to my practice. Then I think the whole situation, like building better connections, it was more like finding the basically people to help me out administratively, marketing, all that stuff, which I think that's when I started like, I don't know, I was so loaded up with stuff that I reached out to you guys to help me, like Virtual Latinos, porque it was very, very hard. Like just at least that administrative and marketing part of it was hard, but the patient interaction is beautiful. As a private psychiatrist, you build like a family with the patients. It's amazing. So at least I try to remember that part, not this one, but that part was beautiful, beautiful.
Okay. Yeah. I can imagine how much effort and energy you invested in creating this practice. So it's really good news. It's excellent news actually. Well, to see you right there right now, and that you were able to find a virtual assistant through us. That's awesome.
No, I know.
Okay. All right, Dr. Diaz, I do want to let you know as well that I was able to check your website, and I noticed something that just caught my attention. And I was wondering if you could just give me, and of course the audience, some extra details in regard to the biopsychosocial approach you use at your practice. So just out of curiosity, could you give me a little bit more details about what
Of
that is?
course. So we usually in psychiatry, depending on the residency program you trained, it depends like what type of basically psychiatrist you're going to be. Let's say it that way. So some residencies focus more on medication management, some focus more on like psychotherapy. So you're a psychiatrist and a psychotherapist. And then some, which is more kind of like the standard of care now, focus on biopsychosocial, which means more biologically. I send blood work, labs, genetic testing, all that biological aspect of the patient, and all comorbid medical conditions too. So all that bio. And then the psycho is more like the psychological aspect of them, if they have any
Mhm.
personality disorders, if they have any trauma. So kind of like that psychological approach. And then the social is like, we live in obviously we're always social, right? So
Yeah.
our work, our family, our friends, our
Mhm.
partners, all of that, how it impacts. So it's more treating the mental health condition as like all that aspect, everything, all of that. Not just necessarily like, well, your levels of this is low, let me just target the biological. No, it's actually the
Okay.
whole.
Okay. Well,
What a
thank
cool
you.
question.
Yes, I had to go through your website, and yeah, that specific point caught my attention because, well, I have never heard of it before, but
Yeah.
thank you very much, Will, for sharing all those details. Now I understand that, well, the service you provide is very detailed, and is also, of course, patient oriented. So yeah, those are
And
amazing.
collaborating a lot. Like I do a lot of collaborating with the patient's therapist and maybe primary care as well, or sometimes OB-GYN, like gynecologist, just because I like treating the patient, and I sponsor that in my practice a lot, like as a whole. This is not just pill pushing or just medication. So it's more like vitamins. How are you doing physically? How are you doing psychologically? So I take pride in doing it that way. I have sometimes patients who I just see for vitamin D, like just supplementing with vitamin D, because it is so, again, it affects all energy, mood, all that stuff. So I don't know. I don't like being that type of doctor who's just writing a prescription.
Okay, yeah, and I love that part of you. I mean, I can feel how passionate you are about your job, and it's really amazing because, well, it happens more often that one would want to find those doctors that are only prescribing medications, and then you're just free to go. So it's really lovely, and it's excellent news that we can find someone like you.
Thank you.
So yeah, so, well, Dr. Diaz, and now I have let's say a personal question for you. So I would like to know what's your main motivation to wake up from bed and keep your practice running? What would you say?
Wow, how exciting. Okay. No, this sounds cliche. I know it sounds cliche, but it would be the patients. It would be that patient interaction.
Okay.
Like just actually like, and sometimes keeps you up at night too, which is a little, that's why I do the yoga and all that stuff. Okay. It is just making sure they're better, making sure they're seen, making sure we're actually providing the care they need, being available for them as well. Kind of like, I don't know, just being there for them. So I wake up in the morning for that patient interaction. And then this is a little personal too, but I feel, I don't know, when I was a little girl, I look back and I'm like, I wanted to be a doctor, and seeing that trust that the patient has with the doctor is just something. So I feel very lucky being in this position that the patient just comes to me for any recommendation, for help, vulnerable, like they just open up about some things that some people go through, which is extremely sad. So and sometimes extremely happy, like I see them get better. So I think it's more that patient interaction. I appreciate how the respect and the communication that I have with the patient, and how they trust me as well. I don't know. I'm in a very lucky position.
Well, it's really lovely and really great to see, well, how passionate you are about your patients. Well, it's just amazing. Well,
Thank you.
Thank you very much for sharing that. Now let's move on to the next question. Okay. And I'm pretty sure I know the answer, but I would like to know what makes your business unique. What do you think?
Okay. Well, multiple things. I want to think that multiple things make it unique, but at least besides the biopsychosocial approach that we provide, I think also I target Hispanics and Latinx patients. And, we provide, again, a care that is more culturally appropriate for that population too.
Of course.
And and I think my providers as well, we're all trained in like LGBTQ plus. So we have a special training for that called like WPATH certificates and all of that stuff, which is more for transgender health and LGBTQ health. So we pride on that. We pride on being very like a very open space, not judgmental, and also the knowledge is there, right? Like the hormonal changes they go through, psychological changes, all that stuff. So we also, I think that makes it maybe a little bit unique, just because which is crazy to me to think, but there's a couple of psychiatrists who maybe don't feel comfortable with that population, at least in the area that I work. And I think we do a lot.
Yeah, I can notice you do a lot, and it's also an amazing job what you're doing, especially taking care of the LGBTQ community. That's amazing. It's really good to know that you are taking care of them, and you are just
and I think that is what makes it, like, I want to feel like that's what makes it unique, right? Porque I think, I mean, everyone might feel comfortable, but then if you do that special, like, extra layer of training, I think that might set us off a little bit, just because not everyone feels comfortable with, like, hormonal medications and all that stuff that goes into it. And at the same time, maybe a little bit of judgment here and there. So we're very good in not providing that type of care. The same thing with substance use. We have like an approach of more like helping them and damage control. I hate that term, but more like controlling the symptoms, not necessarily judging.
Yeah, I could also see that in your website, that you in regards to the substance control, you also take care of that. So that's also amazing, and it's excellent. So yeah. Yeah, you're just doing a very remarkable job, and it's just wonderful.
Thank you.
Okay. So, Dr. Diaz, what would you say now is the key to your success?
Wow. Like, I think right now it's the team that I have. Seriously, like, I am very lucky, very blessed to have found Virtual Latinos and have an amazing VA right now. I have a practice manager who's incredible. The providers are incredible. So not only the patient, but my success right now is because of my team. If I didn't have them, I think I would maybe be successful, but my mental health would not be good. So I think to be balanced in that way, I need a good team.
Yeah. Yes. Team is always the key. Well, I'll say it's the key to success. So yeah, that's an excellent answer. So, and it's also very lucky for you that you were able to find that perfect team and the perfect VA. So that's just amazing. Well, it's really good to know.
If it wasn't for them, I'm being honest, if it wasn't for them, I don't know. It because it is not taking care of patients. It's not just, I would love to do it myself, but I know I can't. Yeah. So they are, and then the communication has been incredible. They understand that sometimes I can say the same thing 20 times via micromanager, and they let it go. So I am very grateful for them. Very grateful.
Okay, yeah, that's amazing. Those are wonderful news. All righty. Well, thank you again, Dr. Diaz. So I'm also pretty sure about what the answer is going to be about the next question, but what would you say is the most rewarding part of your job?
Okay. I think it's getting patients better. It sounds cliche, I know, but it's the truth. It's the truth. When you go into this practice, when you go into medicine, that has to be the goal. There's some people with different goals, but it's just discharging patients, which is crazy, right? Sometimes other providers are like, oh, you're losing the money, you're losing the income. I love seeing them better. Like, it's like, okay, you're doing better. Let's get you off the medicine. You can do this. It's just being part of maybe that process of seeing them grow, seeing them get better. Is just extremely rewarding, extremely. I sometimes, if we have a patient that's better, I tell the team, like, they're discharged, they're doing great. And we all kind of like have a mini celebration through the chat or what. It's just very, very, very rewarding.
Yeah, though that's amazing. It's as I have been saying, it's really lovely, really great and rewarding to see that you do take care of your patients, that you do take pride of what you do, and that's just excellent.
See.
Perfect. Yeah, great, Dr. Diaz. So now, moving on to the next question, what would you say is the biggest challenge as a business owner?
Ooh. No, I'm kidding. So the clinical aspect, I think that's what I do it for the patients, for just that interaction, everything that I said before. But the business aspect of being a business owner, that's the whole thing. I don't know how some people do it. It's just the finances, having to manage that, having to manage the marketing, having to manage, like, it's client or patient concerns. It's a lot. And I think it's more, to me, having to be organized. I hate it. I like my chaos here and there. So having to be organized to run a business, it's the most difficult. That's why I rely on my team, because if not, I couldn't do it. But as a business owner, you have to be organized, and you have to be very prepared, like all of the stuff that I think I know my flaws and I'm not great at that. So I think I rely on my team in that sense.
Okay. Well, that's also excellent news. I mean, that you have a VA and and a team that can help you exactly with those, let's say, tasks that you don't have the energy, time, to do.
Or mental capacity. I just think they're brilliant at this. I know my limits. There's people, like the fact that they're so organized and color coded, they put me everything pink, green, because they know I like that. I was like, that makes the business process easier, but I don't have the capability to, I don't know. I'm not like that. Give me the patient, I can do that, but not the business, Excel, spreadsheets. No, I can't.
Yeah, I get it. I totally get it. Yes. And it's also great news that you that you have the team to help you with that. So that's amazing. So now, Dr. Diaz, what would you say, or what do you think is the direction your practice is going to?
I hopefully continue to grow and help more patients. That's the goal. And I would really like to target those populations that I feel need more, like minorities, Latinx, Hispanics, LGBTQ. So hopefully grow to help out more patients and possibly in the future be capable to accept more insurance so I can help more patients. So that's hashtag 2023 goals.
Wow. Okay. It's really, it's just amazing to know that you are looking forward to grow so much, that you want to help so many people. That's amazing and remarkable. Yeah.
Thank you.
That's great, Dr. Diaz. So now, do you see yourself and your practice working remotely in the long term?
I think so. I think so. There is this, which I literally was reading last night about this public health emergency that is very important for us psychiatrists or telemedicine providers, because once that stops, then we might, depending on the laws, we might need to go back to hybrid, some in person, some not. But my team and everything, we're already so structured virtually that we're going to keep it like that. It would just be maybe me and the providers having to have that patient interaction in person.
Okay. Well,
and hopefully it doesn't happen. I would prefer to keep it this way.
Yeah, of course not. Yeah. So, what would you say what has your experience with working with someone remotely been like?
Oh, great. I really feel like the communication is there when it comes to the team. And I think they understand my anxiety and having to repeat things over and over again. But so it's been amazing that way. And then with the patients, I think so too. I get a whole different view of their lifestyle. Sometimes they're in the car because they're outside of work. So, okay, anxiety's high. All that stuff. And I see sometimes their animals, their rooms, and so you get another insight into their lives.
Yeah. Okay. That's amazing. You get to know your patients even closer.
Even closer. See.
That's excellent news, and that's actually one of the, let's say, good things that the pandemic brought. So that's
yes.
Yeah. So there is something that we can be thankful for. The pandemic.
That's true with everything.
Yeah,
right. That was so positive. I needed that. Yeah, you're absolutely right.
Okay. So thank you very much, Dr. Diaz. Now let's talk a little bit about Virtual Latinos, and we would like to know, why did you decide to hire through Virtual Latinos?
I am going to be very honest, because there's Latinos in the name, number one. And then the website and all the marketing looked beautiful. At least I like color. I like everything organized. And you guys are perfect at that. Perfect. Even in the emails, everything is perfect. The communication has been incredible. I think as soon as I reached out, we scheduled something. It was just perfect. And I really think it's, again, that attention to detail that you guys have. I appreciate that a lot. It's like an email here, a reminder here. It's just very, again, the communication and the attention to detail.
Wow, that was just lovely. Thank you very much. We also take a pride of it. So we are we take a pride of being very organized and detail oriented. So thank you very much. It is highly appreciated. Alrighty. So, just to finish this interview, Dr. Diaz, I just have 2 more questions for you. And that will be that I want to know if our community wants to reach out to you, where can they do that?
Perfect. The best way would be through the website that you just checked out already. So like betterconnectionsfl.com. Also, they can give us a call if they wanted to. And then our awesome assistant will answer the phone. It's 352-308-1485. But usually through the website will be the easiest way.
The easiest. Okay, absolutely. Thank you. So, well, the very last question will be if there is anything else that you'd like to share with us right now.
Again, not trying to be, but I am very appreciative to get to work with you guys a lot. I am very grateful. My VA has been incredible. I think I'm going to even hire another one. I've recommended it to other colleagues, and I think two of them have already signed up with you guys. So it's been very good. Not necessarily just because I'm supposed to talk about my business, but I'm being honest. That's the only thing I want to add. You guys have been incredible. I appreciate it.
Absolutely. Well, yeah, on behalf of Virtual Latinos, please accept my big thank you. It's a pleasure to have you in our community. We are very grateful to have you here, and it has been a pleasure working with you. And I hope we can continue working together for a very long time. So that is going to be it for today, Dr. Diaz. Thank you very much.
Thank you.
No, it's my pleasure. All righty. So thank you, Dr. Diaz.
Bye-bye.